Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the coronavirus pandemic in our state at GBMC and also nationally. So we have some glimmers of hope. The Centers for Disease Control has released information suggesting that we may have peaked in the United States of America as far as new cases go. The numbers have started to trend down. In the state of Maryland, hospitalizations remain at the plateau that they've been at for a number of weeks now. The good news continues to be that although there are many Marylanders in Maryland hospitals, a lower percentage of those are requiring the intensive care unit. At Greater Baltimore Medical Center, today we have 31 COVID-19 positive patients, which is somewhat fewer than we did the last time we reported this, and we only have one patient on a ventilator. So we have plenty of capacity for people who are sick and require the intensive care unit. Let's talk about vaccinations. So as of today, GBMC has administered more than 4,000 doses. Most of those doses have gone to GBMC employees. We have been following the state guidelines. We've started with immunizing doctors, nurses, and other clinicians who are at highest risk, those in the intensive care units and in the emergency department. We moved on to immunize all other clinicians that wanted to be immunized, especially nurses caring for COVID-19 patients in our regular inpatient units. Once we had immunized all clinicians on our staff who wanted to be immunized, we moved on to the rest of GBMC personnel, like me, people in support and administrative functions. When the governor authorized the state to move to so-called 1B and immunize people 75 years of age and older, GBMC began to immunize our patients, our GBMC Health Partners patients who are 75 years of age and older, and we also added sessions for community members who do not get their primary care from us, but are older than 75. Next week, we will only be giving second doses to people who have received the first dose of either the Moderna or the Pfizer vaccine. All of our slots, and we are now giving approximately 300 doses per day, but all of our slots next week will be taken up by people who are getting the second dose. On Monday, February 1st, the governor will allow us to move to the state's 1C tiering. 1C adds citizens who are 65 years of age and older. And GBMC will start immunizing people 65 and above on Monday, February 1st. The issue is rapidly becoming not the capability of giving the vaccine, it is becoming the number of vaccines that we have. The number of doses that we are getting weekly is significantly lower than it was at the very beginning. I know that you have read in the media that we have been slow to give vaccines. I personally do not believe that that is true. It took the whole state a while to get the system up and running. Now the system is up and running fairly well, and the true bottleneck will be in the number of doses that we receive. So we are so grateful for the patience of people in the community. We want to immunize everybody who wants to be immunized as fast as we can, and we have been working hard to do that. But again, the rate-limiting step will be the number of doses that we actually get. We are actually getting the doses directly from the federal government. The state is in communication with the federal government, but it is the federal government that is determining how many doses make it to the state of Maryland each week. So stay tuned on this. Now, in the interim, while you are waiting to be immunized, and even after you have been immunized, please continue the 3 important things. Wear your mask, wash your hands, and stay socially distant. We can't guarantee that somebody who has been immunized is not carrying the virus or still able to transmit it, although the risk is much lower once you've been immunized. So until the rate of disease in the population drops to very low levels, we still need to wear our masks, stay socially distant, and wash our hands. Like you, I can't wait for the day when I don't have to wear that mask. But for now, please keep wearing the mask. So let me thank all healthcare workers for their wonderful efforts, and let me also thank you, the community members, for doing those 3 things. GBMC is ready to help you if you need us. If you have symptoms of disease, please contact your healthcare provider, your primary care physician. If it is an emergency, call 911, come to the emergency department. We are here to help you if you need us. Thank you.